Hi, I'm Anthony Gosh, consultant spinal neurosurgeon and founder of the Spine MDT. And this video answers the question, is spine surgery the last resort? Well, the answer is no, and I'm going to explain that. If you've seen my previous videos, you're immediately going to say that I'm contradicting myself, especially after this previous video that I posted, why surgery for back pain doesn't work, advice from a spine surgeon. Well, in this video, what I'm trying to explain is that surgery isn't really the answer for back pain as such. It's more the answer for trapped nerves or a trapped spinal cord where you've got neurological problems, i.e. weakness in the arms or the legs, or sometimes pain down the legs. But there are some scenarios where surgery might be the answer. And in a separate video with a link posted below, I have covered when spine surgery might be the answer. But we hear numerous kind of false or abnormal beliefs around back pain and the spine, and one of them is that spine surgery is a last resort. And the trouble with that belief is that people will often put up and live with the pain and really grit their teeth and bear through it and undergo multiple repeated treatments, such as visiting a chiropractor and having manipulations, adjustments, back cracking essentially done. It keeps coming back. And the point I'm trying to make with this video is that it's just the wrong way of looking at things. You don't undergo a procedure because it's the last resort, and just because it's the last resort doesn't mean it's going to work. You undergo a procedure because there's a good body of evidence suggesting that it works for your condition. Whether it's the last resort or not, it comes down to your own personal circumstances because every patient is unique and different. So at the Spine MDT, we practice patient goal orientated treatment. What are the goals that you want to? And that's because for the same condition of the spine and same symptoms, different patients will have different needs. So needs of somebody who wants to train for a marathon or a triathlon or lift heavy weights are going to be very different from the needs of someone who just wants to spend some time picking up, cuddling their grandchildren or going for nice gentle walks. So a common strategy that I've seen online from non-surgical spine care practitioners is trigger avoidance techniques, teaching you to avoid the certain things that trigger the pain, or movement modifications. The trouble with that is, does trigger avoidance hinder you? Will that mean that hinders you from doing the things that you enjoy because they trigger the pain? And does modification of a movement hinder your ability to do something well? So in the context of a power lifter, does that modification limit what the amount you can lift? Now, for some patients, and I've interviewed Stuart McGill and Peter O'Sullivan, both big names in the world of back pain and spine care, in the non-surgical world of back pain and spine care, who have successfully managed to modify movements and techniques and ways of thinking about things to help improve people's symptoms. And in the context of Stuart McGill, he's managed this successfully in quite high-performing athletes. And this is why I think it's so vital that there's open channels of communication between all the different types of people that treat a patient, whether it's a physiotherapist or a surgeon, that they're both communicating with each other to find the right solution. Sometimes the modification to movements and trigger avoidances will work perfectly well and will not hinder you from doing the things you love. If it's something like going for a walk or picking up your grandchildren, but sometimes surgery will be the solution. That's why I think it's really important to bring the different disciplines together around the patient's care, and that's what I tried to create with the Spine MDT. So to summarize, don't undergo surgery because it's the last resort. That doesn't mean it's going to work. You only undergo surgery because there's a good body of evidence that it's going to work. And then when you're seeking treatment for your back pain, whether it's from a surgeon or whether it's from a physiotherapist, osteopath or chiropractor, make sure that they have access to each other. So if you see a chiropractor or a physio, make sure that they have access to a surgeon that they can discuss other options with. And the same goes with when you choose your surgeon. Make sure he or she has access to other therapists and their skills, so that you know in your mind that the right decision has been made around your care. So please visit us at spinemdt.com, where you can take our online spine assessment tool and we can get back to you. And if you found this video helpful, please click the like button and subscribe. It really helps people living with back pain and spine disease find information that I try and post on this channel every week. Thank you for listening.